What's a labrum?
It's the middle part of your wiener.
I see your comments and I've read them all, and recently I got a lot of suggestions to check out the TV show Bob's Burgers. So we're going to take a look at some of the strange and crazy medical type situations from the show. I've never seen Bob's Burgers before, but of course I had to do my research for myself and for those who might have not been familiar with the show. Bob's Burgers is an animated American sitcom that centers on parents Linda and Bob and their children Tina, Jean, and Louise, who run a hamburger restaurant. But before we get into it, my name is Doctor Jordan Wagner. I'm an ER doctor that deals with every medical situation that you can think of. Gunshot wounds, COVID, broken hips, firework mishap. I created this channel to answer the medical questions that I get from people every single day. If you find this video helpful, please smack that subscribe button and turn your bell notifications on. That way you are notified when I post a new video. Let's dive right in.
Hey, how's it going? I'm Dr. Eigerman.
Look at that face! So young! I'm gonna breastfeed that face!
Me and my colleagues get that all the time, that we're too young to be doctors. That's why we wear the white coats or badges that say doctor on it, just to make sure that everybody knows that we're the MD or the DO walking in the room.
I think I just need a few stitches.
Stitches! Great. Those are no problem for a doctor? Hey, finger crotch!
Why do people keep calling it that?
Okay, first, stitches, sutures. Okay, we'll sew you up if you get lacerated. Pretty simple procedure. But I have no idea what a finger crotch is. I gotta figure out what this is on the show.
Let's stitch you right up here.
Okay. Oh! He's probably injecting a type of lidocaine to anesthetize the area, right? And right in between those fingers. Really painful. You got to be careful. There's nerves that go along every single finger on each side. And then right in between there, you got bones and blood vessels. So just have to be aware.
Oh boy.
Look at me! Look at me!
How about if
Look at me, you'll be fine. He's a doctor. Remember that time you were on vacation, you were in the water?
So many times people sit in these situations, they want to faint or pass out. The best place to pass out is the hospital with the doctor around. If you're feeling faint, lay down. We'll give you some juice, something like that, so we can continue to try to fix you. I like that the patient's being distracted by his wife.
Fun. Oh, you're having fun, right?
I don't remember
See?
that. Wait, are you watching a video?
How to give stitches?
Of how to give stitches?
I guess he doesn't know exactly how to do stitches. Listen, in med school, you actually learn how to suture somebody on different types of material. Sometimes they actually bring in like pig's feet. You know, that way you can do it on a real person when the time comes.
Yeah, man. Oh, text.
You never do it in front of the patient either. Put your phone away.
Proud of a little doctor.
Yeah, we're celebrating tonight. It's my first day without the attending physician supervising me.
Wait, first day?
First patient? Woo!
You don't want to give that away to the patient, right? Everybody has a first day, and your patients want you to be confident and know what you're doing. Go in with confidence, and everybody will be happy, and you'll get what you need to get done.
Oh, you want me to take a picture for your mommy? Bobby, you take a picture of us.
Well, then I kind of...
Bob, take it. Take it.
All right, fine.
I can say I do remember my first day of work, and actually the biggest issue with my first day of residency basically was trying to figure out the computer system.
Pickled something. Ugh, what is wrong with me?
Oh!
Are you okay?
No.
Oh, dislocated shoulder?
Went down pretty hard.
Broken shoulder?
Bob?
Gyro? Oh, God, I think my shoulder is broken.
It's not broken. If it was broken, you would know it.
Oh, don't say that. That's just something people say. I'll see what a doctor says.
People do say that all the time. You'll know if it's broken. Broken versus contusion versus hematoma versus sprain. They all kind of feel the same way. People come in basically saying they know it's broken because they can feel the bones crushing against each other and making weird noises. Sometimes even with dislocated shoulders, you can see the obvious deformity.
It's not broken. If it was broken, you'd know it. It's a torn labrum.
Torn labrum has to do with the shoulder joint, and it's pretty common. You know, orthopedic surgeons can potentially do some different things to help it. It all depends on the extent of the injury and the different medications that are available to the doctor that you are seeing.
What's a labrum?
It's the middle part of your wiener.
Close. The labrum is cartilage in our shoulders that helps us do movements like this.
Definitely not the middle part of your penis. It is part of your shoulder, and the doc in the video explains it pretty well.
And this.
All right.
All right.
Well, I don't do a lot of high-fiving, but I'm worried I'm not going to be able to cook.
Oh, you should.
I should what?
You should high five.
Okay, so when will I be able to do that?
and cook.
Right after the rehab, that's right after the surgery that you need.
Wait, I need surgery?
Yeah. Sandra!
All right, so definitely interesting. When can you go back to work or cook? That's what we get all the time from patients. A lot of times the individual doing the surgery will know pretty much when you'll be able to get back to work. Could be weeks to months to even a year. It all depends on the extent of what the surgery is and how well you heal thereafter.
Itchy! Gene, what is it?
Itchy? What the heck? Whoa, getting woozy. Oh.
You know what? I'm gonna.
Oh, he's itching his butt. Oh, that's so sad. I don't know exactly why he's having an itchy butt. There is multiple reasons. One, you don't clean yourself well enough, or there's leftover toilet paper in there that can cause irritation, or there's something really gross and weird called pinworms. These little worms that come out at nighttime can itch your butt. Kind of gross, but it's very common for kids to get this and very easily treatable too.
He has all the signs, Mom. The itching, the crazy look in his eye, like a boy whose butt is possessed.
Oh, there we go. Look, describes having pinworms. So you gotta wash your fingers, they get under your nails, and then you can pass it along to somebody else. And the only way to get pinworms is to actually ingest them. Really disgusting.
I thought you guys were washing your hands like all the time.
It's Jaden, Dad. He's not a clean child.
Okay, I'm gonna go online. There won't be any horrible images when I type in pinworms, right?
I'm sorry. I don't know how it happened. I washed my hands a lot, even though it went against everything I believe in.
Pinworms are easily treated with an anti-parasitic type medications that's safe and it goes away super quick.
Hi, how's my little barfy baby boy?
Okay, why is he in the bathroom?
Yeah, I was bored and I found some old makeup in the medicine cabinet. I also found some old medicine, but I'm gonna sell it.
It's a great plan.
All right, old medicines. So once a medicine is prescribed to you, it probably lasts up to maybe a month to 3 months because the manufacturer can't have it go longer than that, or he can't say that it'll last longer than that because of exposure to air after it's released from the seal that it initially came in from. Medicines probably last a little bit longer and they degrade over time.
Turkey, I need you beside me. And what's that hiding in your hole? I could still be a winner when I eat Dad's Thanksgiving dinner.
That was beautiful, Jane.
Thank you, Father.
Oh my
Okay,
gosh.
it's time for the test. You know the drill. If you can keep some crackers and ginger ale down for 30 minutes without barfing or juicy pooping, you can come out for
There we
Thanksgiving
go.
dinner,
All right,
okay?
so now they're doing what we call a PO challenge. We do this at the hospital all the time, where you're giving somebody something to drink and food and seeing if they vomit it right back up or if they have intense diarrhea. If your body is having any of these reactions, it doesn't want you to eat or drink. We get it so many times that people will say, I vomit every time I drink water. Well, my first statement is don't drink water yet. Your body's not ready for you to get hydrated. Anti-nausea medications, and then sleep, relax, give your what we call bowel rest. So allow your body to rest and kind of recuperate.
This apartment's too small for anyone with the stomach flu to be mingling. It's our system and it works.
I bet he barfs in 10 minutes.
And we call it the stomach flu. It's not necessarily the flu. It's just a different, usually a virus causes it, not just the influenza virus.
Should we do a pool?
I am not gonna barf again. I'm feeling great.
Okay, all right. Oh gosh, okay. Be gentle. You gotta be really gentle.
Fine.
Oh.
It's coming out both.
Oh, that's the worst. You have retching or vomiting, and there's so much force that's going out the one way. Sometimes it causes intra-abdominal pressure as well, and then you poop your pants. Horrible. I feel so bad when people have to go through this.
I'm so sorry, Gene, but no Thanksgiving dinner for you today, baby.
You don't want Thanksgiving dinner. It's just gonna come right back up.
Guess who just went to the doctor for his 5-year checkup? Me. Last time it negative 3 years. Doctor stuff. You know, your cholesterol's off the charts. You absolutely must change your eating habits or you will die.
Oh, right, exactly. So I feel like doctors, we're all broken records, right? Lose weight, eat healthy, cholesterol's too high, blood pressure's too high, that sort of stuff. It's true. We have to say these things and we're being honest, but a lot of people are like, forget about it. I'm just gonna live my normal life. I don't feel those effects, but over a long period of time, those will actually wreak havoc on your body and cause major issues.
1 cheeseburger and fries, please.
maybe you should be a little concerned, right? You eat a burger pretty much every day. That can't be good for you.
Well, a burger a day, it all depends. There's studies out there on this something called the carnivore diet where people are eating just mostly meats, specifically red meats. And so far, some people are doing really well, but there's no long-term studies on just eating meat all the time. In general, in our Western diets, you just have to be aware, question if eating too much red meat is bad for you. And according to the College of Cardiology, definitely need to stay away from a lot of red meat because it potentially will build up plaques, or that's what they believe, and can lead to heart disease and strokes.
Don't you eat your burgers every day?
Not every day.
Yeah, we order off menu. That's how we have fun, right? Kill me.
That's nice. Anyway, cheeseburger and fries, please.
You sure you want to ignore your doctor, Teddy?
I'm not ignoring him. I'm just not listening to him.
I like that comment. I'm not ignoring him. I'm just not listening to the advice. Okay. Don't ignore us. Please listen to some of the advice that we give you. Oh, geez, dreaming.
Bob's Burgers.
This is Teddy's doctor. Let's take a look at Teddy's heart, shall we?
Okay.
Oh, geez. Oh, that's really strange. I like the dream. Oh, whoa, cool. Actually, they did a really good job of having the coronary arteries on the outside of the heart, which is a good depiction. That's kind of how it happens in real life. But you can't remove the heart that easily, obviously.
Is show and tell?
See how disgustingly unhealthy it is? And it gets bigger and bigger with every burger you serve him.
Oh, geez. I like that the burgers are going directly into the heart.
Keep them coming, Bob.
Actually, there's something called different types of cardiomyopathies where the heart gets larger and doesn't work as efficiently. As the heart muscle gets bigger, just like any other muscle that we have in our body, it gets more tense and stiff, so it doesn't function the way that it should, and you can get something called congestive heart failure, you get fluid in your legs, fluid in your lungs, and then can lead to all these other problems. So it's pretty true. All right, these were really funny. I've never seen this show before, but the amount of medical scenes and information that they threw in there is actually quite hilarious and, depicted really well. Do you have a favorite show that features medical situations that you want me to react to? Let me know in the comments which show or episode. And if you want to see me react to video games, check me out on the Experts React series on Gameology right over here. And as always, make sure you subscribe if you want to see more fun videos like this one. Thank you so much for watching, and stay healthy, my friends.